Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 12th of May. The picture as far as COVID is concerned is that we've currently got one actively COVID positive patient in the hospital, somebody who's been admitted this week, and we've got two patients who are with us because of COVID who are now over the 14-day period and therefore thought not to be infectious. I'm happy to say we've got nobody in critical care because of COVID, and we've had no further COVID related deaths in the last 7 days. I suppose the fact that we've got one active COVID patient who's poorly just reminds us that the disease hasn't gone away altogether and that we must remain vigilant. And in fact, if we look at the community data for the Fylde Coast, the data's gone up this week. So for Blackpool, we're showing 24 cases per 100,000. For Fylde, it's 22 per 100,000. And for Wyre, it's 20 per 100,000. This time last week, we were in single digits. So it's another reminder, isn't it, that we need to be careful and vigilant, despite the fact that we're all delighted that the lockdowns are easing. So on that point, if you are symptomatic, if you've essentially got flu-like symptoms, please do put yourself forward to get a test. And it's ever so easy to get a test still. There's loads of capacity. Dialing 119 or going on the NHS UK website will get you through to an appointment for a PCR test. On the vaccination front, vaccination's of course still a great success story for the UK and the NHS, and we're now vaccinating anyone above the age of 40. So if you're in that age group, anyone above the age of 40, you haven't yet had a vaccination, again please go on the NHS UK website or dial 119 and arrange an appointment. And then what we'll see over progressive weeks, of course, is that age group continuing to come down. What I would say is that the NHS UK website is a fantastic source of information about anything medical really, and we've seen through our own emergency department quite a lot of people who are worried, for example, about possible side effects from the COVID vaccination. Still very clear from an NHS perspective, from a medical perspective, that the benefits of vaccination far outweigh any reported risks. But in any case, the website is really useful. So I'd urge you to use that if you're seeking some particular information. On the subject of attendances, our emergency department, like I think emergency departments all around the country, has been really very, very busy as lockdown eases. So we need to remind everybody to think about self-care if you're poorly with home remedies, to consider accessing your pharmacy services if you are seeking some advice, and then to think about using NHS 111 for advice as well as your GP surgeries. In fact, it is possible to get a booked appointment into our emergency department through NHS 11 First. So it's a really good source of, first of all, information and then a booking, if necessary, into the system. So I think as a system we need to use that more and more really. If attending outpatients, although we have eased our visiting arrangements, could I ask that if you can come by yourself, that you please do. We're still, of course, maintaining quite strict infection prevention and control arrangements, and therefore our outpatients department is getting very, very busy. So if it's possible to come by yourself, please will you. Quite understand that you may need to bring somebody with you for support, and of course we will accept that, but if you can come by yourself, that would be much appreciated. So thank you for that. Finally, today is International Nursing Day. I just want to pay tribute to all our nursing colleagues in this organisation and in fact everywhere else. It's clear that our nursing colleagues have borne an enormous burden through the COVID period, and as ever have shown great professionalism and great kindness and love and support to our patients. So I want to say a big thank you to them, and I hope all nurses everywhere have a great day of celebration and professional reflection. Thank you as ever. See you next week.